The COVID-19 pandemic has highlighted how dire the situation in government hospital is. The country is battling with severely under-resourced hospitals and inadequate staff numbers to cope with the demand. Now, with fears of the country being hit by a second wave, we turn our attention to the state of South Africa's hospital. What has been done? Are we prepared for what is to come? Our senior reporters Aviwe Mtila, Tatia, reporters Monique Motlok and Mankopa Mkunu are on the ground for us. And let's start off with you, Aviwe. Tell us a little bit more about where you are and what is it that you've seen?
I am in East London at the moment at the Department of Health, Jane, where, of course, you'd understand the issues around Eastern Cape. We visited Nelson Mandela Bay just last week, where we saw the state of the public hospitals there. They're full to capacity in terms of the numbers in the casualty wards. But what's more alarming there is the mortality rate, Jane. You'd find out that half the people that enter those casualty wards don't make it out alive, as well as 80% of people in ventilators do not also make it out alive. But just to expand on this and to understand the picture in the Eastern Cape, I am joined by the acting head of department at the Department of Health in the Eastern Cape, Dr. Sibongile Zungu. Doctor, thank you for joining us at eNCA. But maybe just run us through the numbers that the province faces in terms of the COVID numbers and the deaths around the province.
The cumulative numbers in the province are at 117,370 something. We just received those numbers last night, and at this point we are seeing the deaths increasing, and also are seeing numbers of patients being hospitalized increasing. The sad part is that the patients do come a bit late when they are in critical conditions requiring extensive care, which at this point is quite limited because the numbers have increased quite exponentially. And also our own health care workers are also getting affected, both in terms of getting sick themselves and also the exhaustion following the more than 7 months of work that they have been doing.
Now, Dr. Zungu, we're going into the December period. There's a hard wave hitting especially Nelson Mandela Bay of the second wave of COVID-19. We are hearing deaths upon deaths daily. Are you ready as the Department of Health to deal with this? Tell us your plans around curbing the second wave.
As a department, we have made readiness plans for the clinical services, and the province itself has a multi-sectoral approach into the response, where we are having the compliance officers that are looking at issues of environmental health compliance, looking at issues of compliance with regulations, and we are working with the districts and the metros to ensure that there is compliance and we limit the number of social events that are taking place. Unfortunately, with the coming down of the restrictions to level 1, the sense within the public was like things have gone back to normal.
How do we deal then with that? Because we see people are out and about, they're drinking in tub vents, the super spreaders. How do we then deal with that? You're saying the measures in place. What are those measures?
The measures in place have been started. Our MEC and the leadership have been going out to the areas, especially in Nelson Mandela Bay, to distribute information to that effect. And the metro itself has communication lines that are open through all media fora, and also they go out physically to do the loud hailings in the communities. We have also been joined by members of the WHO. At the moment, we have a 15-member team in the province. They are doing issues of risk communication and community engagement.
How do we then sweep into the issues around corruption? We've seen in OR Tambo district issues around the corruption undergoing COVID-19. How do we tackle those issues? And I can't not mention even your appointment has been marred around issues of corruption, data coming back from KZN with the public protector findings around those mobile health units. How do we then have faith even in yourself?
I'm glad you bring up that question, because this is a time when we are supposed to be innovating. However, with all the investigations that are taking place, people are fearful now to take major decisions that could make a difference. For instance, if you talk about issues of mobiles, these are the issues that would make a difference, where you don't want communities to come to health facilities, and you rather get out there and provide a service that is more amenable to providing quality health care. And if you look at issues of PPE, for instance, at this point with the rising numbers, you might find that we run out of PPEs, and the service providers might not be keen to provide, because they have been subjected to all sorts of investigations. And also, before you pay, you have to go through a stringent system to verify the orders and all of that. So the quick response that we had in the first wave might be dampened actually by all the other parallel issues that are happening.
The investigations around 4 mobile units that allegedly the prices were inflated to 61 million rand. We understand only 2 of those mobile units came to fruition. Those are serious allegations around you, SG.
That is a matter that, if I can explain it to you, as you are giving me the interview now, the mobile units that we are talking about, it's 1 mobile and 1 bus. And what happened after that, it's things that happened after my time. However, that matter is going to court, because I do feel that that matter has to be taken to task.
Okay, thank you very much. Dr. Sibongile Zungu, the HOD of the Department of Health in the Eastern Cape, saying that they have measures in place, because we would understand, even the interviews that we've done, there were issues around the behavior of people. They're saying that they're ready as people tackle, even the Nelson Mandela Bay go into that second wave. They're saying that they're ready on the floor. But of course, the province has also been marred by allegations of corruption.
And a perfect example, Aviwe, I'm going to leave it there, about why state hospitals are struggling so much when, corruption allegations get in the way and actually distract from the sort of work that needs to be done. It makes you sick, doesn't it? Let's go.